Welcome back to Good Living, and it's time to have our Canterbury District Health Board catch up now. And we're having a chat with Dr Matthew Reid, who is the author of a new report on Maori Health. So welcome, Dr Reid. How are you?
Good, thank you.
Now tell us a little bit about the report. It's a report on Maori Health. First of all, what's it called?
It's called Hauora Waiaha, so that means Health Canterbury.
Right.
And then it's called Hauora Waiaha 1 because it's meant to be something that we repeat again sometime in the future. And it's a health profile for Maori in Canterbury.
So why was there a need for such a report?
Well, we've had a lot of statistics and data about Maori health in Canterbury over the past, but we haven't ever comprehensively had it all brought together in one place so we can have a comprehensive look at Maori health all in one place and compare Maori and non-Maori health to see what the differences are.
And that's obviously important for our region as well.
Yeah, definitely. We have had national statistics about Maori and non-Maori health, but one sort of impediment to doing local action to improve Maori health is that we haven't known exactly what the local situation was.
Okay, so when you write a report such as this, what's actually involved? What do you do? Well,
we get as much data together as we can, statistics from different sources, from census, from health statistics from the hospital and deaths, surveys about smoking, about drinking, about all sorts of things. Get all that information together, we manipulate the data so it's easy to compare Maori and non-Maori, and then make graphs and tables and so on to make it interesting to look at.
And obviously this is going to be crucial for people in the health sector to be able to refer back to this report? Yeah,
so I finished the main writing of this report last year, the end of last year, and since then I've presented the findings to Mana Whenua ki Waitaha, which is a group representing Ngāi Tahu in Canterbury, and to the board of the District Health Board, to a board meeting just earlier this month. And now we'll be looking at what things we can do about the findings that we've identified in the report.
Okay, so let's talk about some of the findings. What did we find out?
So an overall picture would be that Maori health in Canterbury in general and on average is a little bit better than Maori health throughout the country.
So that's good.
That's a positive thing, but it still is, it lags behind non-Maori health in general in Canterbury. So for things like cardiovascular disease, so heart attacks, angina, that kind of thing, Maori are more likely to be hospitalised and more likely to die from that kind of thing. And for ischemic heart disease, hospitalisation is about the same as non-Maori, but the Maori are more likely to die. We looked at various things that we do for heart disease, and that's in the report. Cancer as well. Maori are less likely to have cancer identified, but more likely to die. That's across all cancers.
Why is it? Is that a cultural thing, or being that perhaps Maori don't go to a health practitioner as often? Yeah,
there's a number of possibilities for that, and we've got national research about what those reasons are. The profile was more identifying what the differences are and not really why the differences are there. So that's a bit difficult question to answer, but that's the sort of thing that the board will move forward to looking at, finding out why the differences are there and what the best solutions are.
And how we can kind of move forward, I guess.
Exactly.
So when you write a report such as this, Matthew, who commissions it? Who's behind it?
Well, it's commissioned by the District Health Board. I wrote the report on the request of Hector Matthews, who's the Executive Director for Māori and Pacific Health for the District Health Board, and Dr Ramon Pink, who's a Medical Officer of Health for Canterbury and has a Māori Health portfolio in public health.
Great. So did you, after being so heavily involved in this report, did you find out anything that was surprising for you in your career, personally or professionally?
I guess not surprising. I think I still found it, even if the statistics in Canterbury were a bit better than nationally, I still found it a little bit shocking that the differences are there, and some of them are really quite big. Diabetes, for example, Māori much more likely to be hospitalised and die from diabetes.
So some interesting, I mean, we could get into this a lot more, but some really interesting kind of issues coming up there, which is great. That's what the report's all about, isn't it? Indeed. Fantastic. Well, thank you so much, Dr Matthew Reid. Some very interesting findings there on that report on Maori Health. Remember, if you'd like any further information with the Canterbury District Health Board, head along to www.cdhb.govt.nz.